Right, this is the hour of the conversation tonight. Thank you so much for choosing in this hour. This is KTN, and I want to once again welcome you to be part of the conversation at KTN News KE on X. You can find me at Doris Anki on X. And it sounds like cliche, but I find it very intriguing when they say your greatest wealth is your health. So guard it, invest in it, but also prevention is better than cure. But what exactly is happening in the country right now? There is a very important thing that I have to mention, that there is a press statement or notice that came forth on the 6th of January 2025 from the Kenya Union of Clinical Officers that gave a 14 days strike notice. Now, there are issues in that particular letter, and the disputes being clinical officers' discrimination from the Social Health Authority, breach of return to work agreement, the RTWA of 2024, among other issues. But because I want to dig deeper and walk that journey with you, especially you watching from the grassroots, I am honored to join the treasurer, national treasurer of KUKO, Mary Boniface. Thank you so much for creating time to be here.
Thank you so much. Thank you for having me.
And we're looking forward to understanding the depth of what could be a looming strike in the next few days. Yes. George Gibore, the General Secretary, the Kenya Union of Clinical Officers, was out in other engagements, but had to create time to be here tonight and shed light. It's so good to see you, Daktari. Good evening.
Good evening, Anki, and thank you very much for having me.
I know we sat down last year, Gibore, and we tried to talk about what exactly you're talking about now in as far as implementations are concerned. Allow me to start with you, because in hindsight, what we expected as Kenyans is that a number of things would be settled. Looking at the timelines that were set then, there was a collective bargaining agreement that ought to have been, sorted 60 days from the date of signing. How far are things? The promotions and redesignations that ought to have been settled by 1st September 2024, the comprehensive medical cover by 1st September 2024, among other things, including the confirmation of the UHC clinical officers into permanent and pensionable terms. Unless I have left anything out, what is the current status of what you're agitating for?
Okay, thank you very much, Anki. As you have highlighted, there are two key issues. That is the discrimination by the Social Health Authority, where they have discriminated the facility owned by clinical officers, and these are facilities registered under the Clinical Officers Act, number 20 of 2017, which allow for clinical officers to own facility. And the Social Health Authority has discriminated them by not onboarding them. Two is also the decision of the Social Health Authority denying clinical officers what we call pre-authorization right, which means that we are not able to see patient directly unless we go through other individual, because the directive is that specialists who are clinical officers including specialists, if they have to see any patient registered under the Social Health Authority, whether emergency cases, you have to do request using an individual registered under the KMPDC, which is against the existing law, and that's what we are agitating against, and we feel that this is an affront against the universal health coverage. The second item, as you have highlighted, is on the return to work formula that we signed last year after the strike notice, the strike that went for more than 100 days with the counties, and also the national government strike that existed, and we signed a return to work after 120 days. And the issues therein remain unattended or unaddressed, because after signing this document, we returned this document and it was registered in court, meaning it became a court order. And by virtue of the government, both the county government and the national government not addressing or rather implementing it is a matter of contempt.
All right.
because then they have failed to hit or rather implement what is the court order. And therefore, our strike is about enforcement of the court order, and where we are pushing that the government must be able to prioritize things right and the health of Kenyans.
Now, thank you so much for that background. Mary is here with me in studio. And Mary, I know you equally feel it. And you're looking at 19th of January, midnight, 2025. Because right now you have said you are ready. You're giving space for conversations and negotiations. But at the point of 19th midnight, then you will particularly see, the clinical officers go out on the nationwide strike. But tell us about the efforts you've been making as a union to perhaps remind the ministries, institutions, looking at the Ministry of Health, among others. Have there been efforts from your end to ensure that you do some sort of follow-up? And how is that then, has it bore fruits? Is it in vain?
I will say that the union has really put in a lot of effort. We have tried to engage those involved. For example, in matters it's been now, a long time trying to do correspondences, writing, expecting feedback, which has not come back. We have had meetings with the several SHA officials.
Okay.
The first chairman, who was Dr. Oleni, is no longer there. We had a meeting with him. We made agreements. And immediately he left office, they stalled. We also met the former CEO, Elijah Washira, and after some time he also left office and the issue stalled. And now when the rollout of SHAs came, the issues that we have been complaining about are here glaring at us and glaring at the Kenyans that we give services to, because they are suffering. Because when we say empanelment, we mean that clinical officers who are registered rightfully by the council, which is Clinical Officers Council, which is a regulator, just like the KMPDC, they have been denied the empanelment, meaning the 1,000 facilities that offer services to Kenyans owned by clinical officers are not able to offer those services. The same way, officers who are specialized, just like Deborah has said, are not able to do services. And what this means is, if I am a clinical officer specialized in reproductive health, I am supposed to do a cesarean section.
Right.
I cannot do that unless probably I ask my colleague who is registered by the KMPDC to give me the registration number so that I can be able to do that.
So what you're saying is it is possible to offer services, but through another person's, is it license or pre-authorization?
License. You have to use their registration number for you to be able to.
What is wrong with that?
It is wrong because I am an officer, trained, registered, and licensed to work, or rather to practice medicine by my regulator, who is the Clinical Officers Council. So then why am I using someone's number who is regulated by another body? And that's why we are saying it is clear, it is in the law, but administratively, someone has chosen to only consider the person registered by KMPDC and ignore the person registered by the. And therefore, we are saying the Clinical Officers Council is an equal regulator, and all the officers registered by this council should be brought on board so that they can practice medicine in those centers down there. In the non-urban, in the grassroots,
yes.
Where, for example, we may have one medical officer or one person registered by KMPDC, and a patient has come as an emergency. I have to sit down and call them to come from wherever they are to come and give me their number so that I can do. So we waste time. We don't attend to these patients in good time, and therefore it means the outcome is not the best that we are looking at, because we risk losing this patient, we risk. So these are the issues that we are talking about, and we are saying let the law be followed. Allow the regulators do their work. Let KMPDC do its work. Let the clinic officers do its work. Let every other regulator, the nursing council, the laboratory, do their work. And these are the things we have been following up on, and we have not been able to get answers. We have also done demonstrations. Between November and December, we have been doing demonstrations.
And I want to come back to that.
Yes.
I want to come back to the demonstrations and why you're agitating against or for certain things so that Kenyans understand. Because there are questions of why are the clinical officers back or talking about going back on the street again. We are hardly a week or two into the new year. But I want to hear from Gibore again quickly on the reasons that seemingly are being used to justify this difference in pre-authorization. Perhaps you can share with us why you're not convinced that the pre-authorization seemingly is denied for the clinical officers and you have to work under somebody else's license. What did they say? What is the argument behind that, and why you're not convinced?
Anki, after the transition from the Social Health Authority, the Social Health Authority transitioned all facilities that were or had been contracted by the National Health Insurance, and they continued offering services. But they excluded facility registered under the Clinical Officers Act and those that are owned by clinical officers. Then that is what we call discrimination. 2 is that all clinical officers who are the single largest clinical service provider in the country have also been denied the right to see patients. Now, we connect this by a statement that was given by the Director General, who outrightly put it like clinical officers have outlived their purpose in the country, without justifying, which I know that even during his interview he was reprimanded, and actually he apologized for having used language that is demeaning the whole profession that has existed in this country since 1928. And they continue to practice professionally and exist under an act of parliament, which means legitimately we ought to be practicing in accordance to our training and our qualification. Now, the Social Health Authority composition, which currently the people who we feel that are now actually, the reason why we are complaining is the Director General and the current chair of the Social Health Authority. And all of them are members of the KMPDC, where they are forcing the clinical officers to use the registration number of members registered under KMPDC, and also forcing double registration for facility registered by the Clinical Officers Council, which is what we feel that they are in so doing. They are actually making life difficult for clinical officers. And unfortunately, as I've said, the law provides that empanelment of facility shall be done after being forwarded by the respective regulatory body. So there is no law that allows the chair, or rather the Social Health Authority, to direct clinical officers to do double registration or to use anybody's license. And you see, this is going to demean clinical officer and erase them from the system by virtue of using somebody's registration number. And that's to mean then the work they do, someone takes credit. Unfortunately, what has happened is that some of them who own private facility, whenever they want to do any procedure for patient registered under the Social Health Authority, they pay the people who now they are being forced to use their registration number. And that is what we call regularized corruption by the Ministry of Health. 2 is that whenever this process, you have to go through an individual to offer services, you delay service delivery, pushing patient to complication, if not death. So there is no way the Ministry of Health can supervise complications or rather push patient to death, and yet they ought to be pro-life, meaning they need to ease service delivery and ensure that patients can be able to access services whenever they need it. Unfortunately, that is what they are not, that's not their priority, right. And that's why they're denying the single largest clinical officers, service provider, a right to do services. And we must say that, as I said earlier, is that we are going on strike to enforce law and order, because as you see, the officers that we have mentioned, deliberately, they have chosen to ignore the law and actually to subvert the law. Thank you.
All right. I just want to also just, you have talked about law and order, and in some of your letters, you're saying you will invoke Article 41 of the Kenyan Constitution. But that notwithstanding, you're also claiming that you have sent numerous letters and petitions to all concerned officers over the past 2 months. I don't know if Mary here will confirm, including the memorandum to the President, a petition to Senate and National Assembly, Ministry of Health and Social Health Authority, without any response. I will come back to that again, Mary, because we have to substantiate that there has been absolutely no response, is it?
Sure. So there has been no response.
And you mean zero, from including the Office of the President?
Yes.
All right. Now, let's get into why we need clinical officers, because I'm concerned about the grassroots and why are clinical officers so important, especially in level 2, level 3 hospitals, I believe, and you mentioned the grassroots. Yeah. And it's not a joke, really, but we had a conversation once where somebody said, Anki, do you know that in certain areas, in the rural area, you'd find that a referral hospital is closed over the weekend because it's off days? Now, that is essentially not a beautiful picture for the health sector. What are we looking at if this strike really comes to pass for those Kenyans that you are actually supposed to be taking care of?
A clinical officer is a medical practitioner who is trained, registered and licensed by the Clinical Officers Council to practice medicine in Kenya, like we've said. And clinical officers are the custodians of primary health care. And primary health care is, that holistic care that is accessible, it's affordable to citizens, or rather to the population.
What does it entail, maybe, just to give a glimpse of it?
Key to it, like I've mentioned, is access, like access in terms of, geographical access in terms of other healthcare providers, like the facility might be there, but when I go there, am I able to get the services in good time, and am I able to get the medication that has been prescribed and all that? And these are the key aspects of primary health care, and this is what the clinical officers offers to the population. Majority of us have been to hospitals, both in urban centers and in the rural centers, and you have been treated, because most of the people out there, when they come to the hospitals, of course, they might not know the difference, who is the nurse, who is the doctor, who is the clinical officer, but majority people have been attended. 90% of Kenyans have been attended to by a clinical officer, because a clinical officer is the primary doctor in the consultation room, and majority times when you go into that consultation room, the person you've seen is a clinical officer.
You confused us a bit. The primary doctor.
Primary doctor meaning the first person you see when you get into the hospital, because the procedure is usually when you walk into the hospital, you go through registration, you go through triads, the nurse takes the blood pressure, and then you're sent to the consultation room. So primary meaning the first doctor you see when you walk into an hospital, and then now treatment starts from there. So this person who sees you first in healthcare, in an hospital, is a clinical officer. And clinical officers spread across all levels of care, right from level 2, level 3, level 4, the specialized one, even including the referral hospitals, because we have clinical officers working in Kenyatta National Hospitals and the Moi Teaching and Referral Hospital.
All right.
Yes. So withdrawal of services then means that Kenyans are going to have it rough, because these facilities will not have the doctor now, or rather now the care giver, the provider, the clinical officer will be out, and that is to mean those people, especially the ones in the marginalized areas, the far ones where the only prescriber, the only doctor that is there is a clinical officer, are going to have a very hard time, because once clinical officers withdraw, then it means that the hospitals will not be operational.
And I just want to come back to you shortly, but let me hear from Gibore. The full implementation of the return to work agreement between the union and employers, here we're looking at the Ministry of Health, and the 47 county governments is one of the other things that were not met. Where does that stand?
Yeah, before I come to that, Anki, allow me justify that indeed we did, when this issue came up and when we started having issue with the ministry, we attempted all the avenue. We wrote to the Social Health Authority, and both the chair and the CEO, the previous one and the current one, both of them never responded, ignored our call. I happened to meet the current chair in one of the meetings, and I talked to him about this issue. And also he asked me to do a short a note in terms of what the law provides, and I did exactly that. However, verbally communicated to me that, and yes, the law, that's what it provides, but unfortunately, he said that he had been instructed by the president just to deny clinical officers their right. And that is why I feel like some of them are even to the extent invoking the name of the president just to violate the law and justify the reason why they continue being in office and yet they violate the law. Two, as you ask about this issue of the return to work, we have a government that I can make reference or rather refer to as being unfriendly, because all the time, even what is clearly provided under laws and the policies, issues like how do you negotiate a CBA and a finalist, including timeline, they never do that until people go on strike for them to respond and come up with probably a response. Unfortunately, like this time around when we went on strike, the Minister of Health has moved. At least we negotiated a CBA and we have concluded. We are waiting for ratification or rather approval by the SRC. But then after the 60 days conclusion of the strike, the Council of Governors, which promised that we were to do this within 60 days, have never had any sitting. So this is the bad governance, and the people who probably do not mind any service interruption, because for them, they don't care. In any case, they seek services in private facility. Even when people go on strike for 100 days, their family are well catered for. And that is the extent of moral degradance that public officers continue to exhibit and yet continue enjoying our resources and the manipulating system, even where the law is very clear. Now, the signed return to work agreement was filed in court immediately, and the court adopted it as a court order. When now the court order has not been implemented beyond the time provided, we are at liberty to withdraw our services, because in any case, the government has gone on strike by not implementing our agreement, and to such an extent, they do not even care whether that agreement exists or not. To make it relevant, that's why the Constitution under Article 41 gave workers a right to agitate, to go on strike, and to picket, to ensure that their issues, or rather their voices, can be heard. I want to say this, that we gave 14 days, and the reason was, if there is any government officer who is willing to address this issue, they have a window period of 14 days to do so that they can avert the imminent strike that we have now invoked. Thank you.
All right, thank you very much, George Gibora, the General Secretary, Kenya Union of Clinical Officers, joining us all the way live from Mombasa. We just want to take a very short breather. This conversation continues. And I like that you said that you're giving a window period of 14 days. No wonder we call that a strike notice. We'll be right back. Don't go too far away.